So lip filler seems like a wonderful thing, doesn't it? Fillers of the entire face. I'm a huge fan of fillers. I truly am, and I want to make that disclaimer. But we always hear about the good, or at the very least, the safe sides of filler, and sometimes we don't know about the risks or what it can actually do to your face on a more long-term basis. Some people call it filler fatigue. Other people are starting to notice that overfilled faces are very recognizable and they look like bad or botched plastic surgery when indeed somebody didn't have plastic surgery at all. The reversible and the so-called semi-permanent or impermanent results of filler are what make them so popular. Also, they're on every street corner, at least in this zip code. But sometimes they're not all they are cracked up to be. And I wanted to present a case today of one of these instances. Stay tuned. Hi, I'm Jonathan Zelkin. I'm a board-certified plastic surgeon in Newport Beach, California, and a huge part of my practice is plastic surgery of the face. And during my training, one of my greatest passions and a huge part of my training, which I don't really do anymore, was going on missions to different countries. And in these missions, we would see a lot of people who had cleft lips and cleft palates, and we'd repair these as part of a mission. It was a really rewarding experience, and it was also a great way to train plastic surgeons in this subspecialty, whereas in major medical centers, usually residents don't have that kind of opportunity. When we go abroad and we see patients in need, it's a great way to not only understand the nuances of cleft lip and palate surgery, but also to gain an appreciation for how hard it is to execute well. Unfortunately, we didn't really get to see the long-term follow-up of a lot of the patients that we treated, but we did get a sense of the complexities. And now, whenever I see somebody or meet somebody who had a cleft lip or palate, I have an immediate recognition of the operation that was performed, and I get an even deeper respect for the surgeon. One of my favorite patients, one of the favorite results that I've ever seen, best results I've ever seen, came into my door a few weeks ago, and she was complaining that whenever she smiled, she had two big flaps of skin that came down and blocked her teeth. And indeed, this completely undid her cleft lip surgery result. She had an injector who continuously over years would inject filler into her lips, and this filler would follow pathways of least resistance. Because the cleft lip scar is a very firm substance, when you inject into that area, the filler wants to migrate around it, accentuating the pre-cleft lip repair state. So this patient had an awesome, if not one of the best cleft lip repairs I've ever seen, completely undone by fillers over time. Unfortunately, the last injection she got, because she was starting to get aware of this, was over a year ago. So this is like permanent now because it's created so much fibrosis and scar tissue that time or dissolver would not reverse it. We tried all these things. So this patient ultimately required surgery. Here's a quick recap of what went down.
Come on.
The operation, as you can see, was quite simple, and it was very effective. In only 2 weeks, the patient was to regain her smile. And it was really rewarding to give this patient back something that she didn't realize that she had that was so special, which was a convincing and almost indiscernible cleft lip repair. This is one of the most rewarding cases and brings back a lot of fond memories I have of some of the mission work that I did in Vietnam and Honduras and Guatemala. And I think that everybody here should recognize that fillers are a great way to enhance natural and normal anatomy, but are not always a replacement for surgery and are not always temporary or reversible. If filler doesn't seem to be going your way and you're doing it over and over again, think twice about continuing that strategy, as it may not be the best one. If you or somebody you know has gone through something like this and has a complication associated with filler, don't hesitate to reach out to a plastic surgeon, because when dissolver is not an option or time, then surgery may be your best choice, and it's oftentimes straightforward and in many cases can be done awake. Thanks so much.